Hello and welcome back to the channel. My name's Matt, and today I'm going to be talking about whether you should take medication for your anxiety. And before I start talking about this, I want to just give a disclaimer that I'm not a medical professional and I'm not a mental health specialist. So you need to do your own research. Every situation is individual. So do your own research and ask people that you think are qualified, and do your own research and make your own decision that's personal to you. So without further ado, I'm now going to talk about what I think is the most important question to ask yourself as a person who's had anxiety for 3 years, and I now feel that I'm basically over it, to be honest. I am not feeling anxiety on a daily basis. I get it maybe once every 3 or 4 months. I get just a feeling of pain in my chest and difficulty breathing, but I know how to deal with it. It goes away very quickly now after using these tools that I've developed in my head, to make myself relax, and I can basically make it go away within 10-15 minutes or so. But when I started having anxiety, I was having panic attacks for 10 to 12 hours a day. I was feeling exhausted from adrenaline. My arms and legs would go numb when I would have tunnel vision. And yeah, basically it was a very unhappy situation. And that happened for 2 to 3 weeks until I started to realize that I needed to resolve these issues and these irrational thoughts going through my head. However, I think that it's important to ask yourself this question before you consider taking medication. Do you think that you have the current mental capacity to use logic and reason to assess your thoughts and whether they are irrational or rational thoughts? I'm going to say that again so that you can really get into it. Do you think that you have the current mental capacity to use logic and reason to assess your thoughts and whether they're rational or irrational? And it's important to decide whether your thoughts are rational or irrational, because most anxiety derives from irrational cyclic thoughts. A thought that doesn't have an ending. It just continues to go round and around. You can't ask yourself why, and get to an end point and say, oh, this is why I'm having this thought. And it's a rational ending. If you were to ask yourself with in an irrational thought, why am I having this thought? It would have no ending. It would just continue going around in circles because the thought is not rational. And so if you don't feel like you have the stability to ask yourself this question, if you feel that you're using physical distractions, or you're rocking backwards and forwards, and you have such intense anxiety that you cannot break the pattern of thoughts that you're currently going through your head, then maybe you do need some kind of external factor to break that pattern. And this is not prescriptive advice because, like I said, I'm not a trained professional, but I do know that from watching other people who are close to me who have had anxiety, and my own experience not taking medication and them taking medication, that certain situations may need to have an external factor like medication to help you to then get into a mental state to go through therapy, cognitive behavioral therapy, or talk to a trusted person to reason through your thoughts, or a psychologist. And so, like I said, I think that question is very important. Do you have the current mental capacity to assess whether your thoughts are rational or irrational? And but now I want to talk about what the actual medication journey might be like. And so I can only talk from someone else's experience because I had a loved one who had anxiety, severe anxiety, and they didn't feel like they were able to assess their thoughts in a logical way. And so they were prescribed a medication from a doctor. The medication basically alters your brain chemistry and they said it makes you feel numb. And the numbness is not numbness only to the anxiety, the fear derived thoughts. It's numbness to quite a few different emotions, and so you feel numb on a daily basis, um, until you start to work through the issues that are going through your head. And you're never actually going to solve your anxiety unless you talk through your issues, because this medication is not a solution. It's just there to buy you time and buy you stability. So you should really, that is a really important point. You need to make sure that you realize this and accept this, that the medication is not going to resolve anything. So you get this numbness. And firstly, you may not work, that the first medication you get may not work. And I'm not trying to give you an additional fear of medication, but I want you to understand what the journey might be like, because it's an important decision for anyone. This person who I know who was taking medication took it for about 1.5 years, and before the medication started working, it took 2 to 3 weeks, and you may get undesirable side effects and then have to back down on that medication and then add another medication, and your doctor will help prescribe this. But obviously, so before it starts working, it may be 1 to 2 months. 1 to 2 months to start working, and then you'll start to book in to see a psychologist or therapist and do cognitive behavioural therapy. And in the UK, that can take a little while to do. So you might want to book that in early, because you need we call it a referral, unless you want to go private. But with the NHS in the UK, you need to go through a referral system, and that can take a month or a month and a half until you start seeing a cognitive behavioural therapist, which is paid for by the government. And then once you start seeing them, you see them maybe once every month, and then you work through your issues. And then after you work through your issues, something else might come up, and then you'll work through that issue, and something else might come up. So it's a long process, and if you are able to figure out the tools yourself, you can speed up this process. And I've got a couple of videos on my channel about how to deal with anxiety long term and how to deal with it short term if you're having a panic attack immediately. And also another video on just general experience and different tools that you can use. But really, the medication is there to increase your stability, mental stability. But it won't make you feel any better. It will just make you feel numb. And I wanted to also mention that it can take some time to wean yourself off medication, because you've been in this mental numbness for such a long time that you need to slowly back off it, in order to get back to, getting used to that level, getting used to the next level, getting used to completely no medication. And so it can be a very long journey depending on how many issues you've got to work through. But like I said, if you need it, you need it. If you feel that you're constantly distracting yourself with mental and physical distractions, like you're rocking backwards and forwards, you're clenching your fists, you're gritting your teeth, you can't deal with the day-to-day at all, and you're taking time away from everyone and everything, and you cannot deal with your current situation. Or you're thinking dangerous thoughts, and you need to get yourself to a baseline stable state, then it might be the right decision for you to take medication. But yeah, I just wanted to give you an idea of what it could be like, and there can be a lot of benefits to it. Like I said, it can be a very distressing situation, especially also to see a loved one who has anxiety or depression, because sometimes they come together, and watching them go through this distressful period and feeling hopeless and that you cannot help them, and them feeling hopeless and not being able to do anything about that. But what I would say is that give yourself a chance to try to work through it without medication. as much as possible, because taking the medication is a long journey, and just give yourself the best chance possible not to take some external medication that is effectively altering your brain chemistry, and it will be taking time to wean yourself off it. You also can get different side effects from it, so um, it's and they're different for everyone. So I can't provide you with exact side effects for exact medication. Also, I've not been exposed to every single medication, so I'm not sure exactly what every medication side effects are, and I'm not a medical professional, but there are side effects to any medication. There are side effects to any drug. The side effects to taking sugar. There are side effects to alcohol. There are side effects to MDMA, LSD, etc., any other recreational drug, and also medical drug. So anything that you put in your body, you need to research. And if the person who is having the anxiety can't research it, then the person who is helping them with the anxiety should at least do some research before just trusting fully a doctor giving you the medication, because it's about your personal situation. Do you feel that you're strong enough to work through these issues yourself? And if you don't, maybe medication is the right route for you. If you do feel like you're able to do it yourself, then maybe don't take medication. But hopefully that has given you an idea of what it's like, and what sort of question you need to be asking yourself. If I had just started having anxiety now, and I wanted to figure out whether to take medication or not, I really would have liked to have seen this video. So this is the reason why I'm creating this video, and hopefully you found it useful. If you have, give it a thumbs up so more people can see it, because it will come up higher in the listings. I've seen a lot of doctors' videos and stuff, but not many personal experience videos. So I wanted to add another personal experience video for someone who's not taking medication and how it feels. If you do want some help with getting through anxiety yourself, then please click on the other videos that I've got on tools that you can use to reduce anxiety and work through anxiety in the description below. But other than that, guys, have a great Christmas holidays. I'm actually in Wales at the moment, just next to Snowdonia, North Wales. Going to be climbing Snowdonia in the next couple of days. So hopefully you have a good Christmas break, and I'll see you guys soon. Stay safe, and peace and love. See you soon. Bye.